be added. So you've spent 5 minutes putting in their like 8, 10-digit Medicaid number and then their date of birth, and then you don't know what is their zip code because sometimes they may have moved. So is it the previous zip code, the current zip code, and then the date of birth? By then you put everything and it may not even show up. So it is much easier to start off by handwriting the first prescription to give them a regular script, so then it automatically shows up in your database, and then to e-prescribe. So you have the patient information already on the device rather than starting from scratch. So I generally, first-timers all get paper scripts. Now, changing pharmacy. Now, this is a problem if, for example, patient does not, the pharmacy does not have the medication in stock. So the patient is e-prescribed to Walgreens on such and such, wherever, and then they go there and they say, oh, sorry, we have to order it. It'll take a week. If it's a paper script, they can say, oh, give me my prescription, and they go to CVS. So that's the problem, So they, even though they can probably email it to another Walgreens, but they may want to go to CVS or Publix or Walmart, and that becomes a little bit of an issue if they don't have a hard copy prescription. So that's an issue. Again, same thing if they want to change pharmacy. Multiple practice locations, that's an issue. What happens is, again, I don't know if that has been rectified or not, but I have multiple places. So I have to make sure that I'm actually changing where I'm originating the prescription from, because if I have 5 different places. But if I want to print the prescription, it'll only print from one location. So I really cannot, especially if it's 2 totally different agencies that I contract with, I cannot put in, one mental health center's information on the other. It's not accurate. So that becomes an issue. So you can't print it out. You can only print, I believe, from one location, not multiple locations. There's some issue there. So if it's multiple practice locations, you can't really print information of each location to put it in the chart if you want to do that. So that is a problem. Controlled substances. I'm a child psychiatrist, and I write a lot of Ritalin and Adderall and all the stimulant medications, which is a Schedule II. And the problem, of course, is that they would fax it to you, and the fax comes very fast. It's amazing. Yeah, it's pretty amazing how quickly it comes. The problem is that if the fax machine is located, 5 offices down, you have to call somebody and say, look out for the fax and bring it to me. And so that's, unless I have the fax machine sitting right there, which is not possible because it's an agency fax, and I can't just have that fax machine in my office. So that is an issue. It does come very quickly, and we do use it. And what I do is sign the fax and give it to the patient. So that's what we have to do. I have had pharmacies tell the patient that we don't take this. What is this? They are capable of receiving e-prescription. So I think that's more like it's an education issue. It's probably a pharmacy technician not knowing that this can be done. But and then again, sometimes they don't get the e-script, but they have the fax, and they won't accept that, the pharmacy. So sometimes the patient has to come back because it's a hard copy prescription that they need. So that has happened. So that inconveniences the patients also. The good thing about it is that it goes straight to the pharmacy. So you don't have to worry that that prescription is going to be abused, or you can stick to one pharmacy, and that helps. So that is the controlled substance issue with the stimulant medications. So that was the first 6 months experience, and we're looking into the future. Of course, there's a lot of advantages. And so we've extended the pilot to December. And we have 2 additional enthusiastic doctors that are that have been trained. Actually, this slide was created a little while ago. So they have already been trained, and they have already been added. And we're hoping that we will put some peer pressure so that other physicians can also buy in. We want to make the physicians aware of the advantages. Again, we have to be ready for the inevitable. And we hope that we can include all patients because we have Medicaid, we have Medicare, we're not able to do the Medicare. We have our indigent population that we have a different system. And so hopefully we'll be able to, expand it to all patient groups. And that's it. So the other advantage that I have is that our EmpowerX guy has been able to kind of add all the physicians to my database, so I can actually look up how many prescriptions are written over a time period. So that also helps. So thank you.
All right, I'm James Zenel. I'm the medical director of Directions for Mental Health, which is a community mental health center over in Clearwater, across the bay. Our service area is mid and upper Pinellas County. And we're outpatient only. It's about a $13, $14 million budget. It's small, small to moderate size. This past year, we saw 4,000 unduplicated adult clients. In our psychiatric services, we saw 900 child clients. Of the adult clients, about 40 to 50% of them have Medicaid or Medicare. The rest are uninsured. For the kids, about 92% of them have Medicaid. It's a pretty fast-running stream. Time really is of the essence here because it's a high-volume operation. Being community mental health, we don't have a lot of money, so it's budgeted to break even. It's not for profit. All our prescribers have productivity standards, so we figured it out. It's 15 minutes for medication management, so I really need to emphasize that time is of the essence. For us, anything that takes seconds is like taking everybody else minutes. And minutes are like hours. Okay, so why are we participating? First of all, we're transitioning to an electronic medical record. We've started about a year ago. Our smaller programs have made the switch. Medical, which is a big program, has not yet made that switch. But what we're experiencing here, I think, is very similar to what all organizations are experiencing in switching entirely over to electronic records. And our intent is that e-prescribing is going to be part of our record, that we're just going to abandon paper as much as we can altogether. So better now, before it's do or die, and our department is entirely electronic, we can do it piecemeal. And really, as we all know, the national standard is going to be e-prescribing anyway, so might as well do it now. For the more noble causes, there's certainly potential for improvement in the quality of care through reduction of medication errors. Depending on the software program, it can link to the drug interaction database. Depending on the software, you get access to the rest of the client's medication profile. Depending on the software, you can get formulary availability data. And of course, you can reduce fraud through things like prescription forgery. And we're in community mental health, and so any money that comes to us that helps us, it helps our clients. We are CARF accredited. CARF is the Commission for the Accreditation of Rehabilitation Facilities. So since we're outpatient, we use CARF. CARF has a major emphasis on quality and quality improvement. So they look at quality in terms of effectiveness, efficiency, access, and satisfaction. So the idea is when you're improving quality, you want to improve in all those 4 dimensions. If you can come up with a very effective intervention that turns out to be extraordinarily